National Health Insurance, or NHI, seeks to overhaul South Africa's healthcare system, but it's caused quite the stir over the last decade. South Africans who can afford medical aid schemes prefer better private healthcare, while poorer South Africans rely on a strained public healthcare system funded by government. The NHI seeks to deliver equitable healthcare for all South Africans so that people in the public healthcare system can access better services.
Daar's nie hospitaalbeddens by die hospitale in Sasol nie. Daar's nie beddens by Kopanong nie. Daar's nie beddens by Sebokeng nie. Maar by Baragwana in Johannesburg staan hier seker 3000 beddens. Sover so die oog kan sien, is dit net hospitaalbeddens wat absoluut niks mekeer nie. Nou vra ek vir julle vandag, waar gaan ons taxgeld heen?
You failed us during COVID with the PPE scandal. You continue to fail us daily, and we will not be silent. We deserve better.
Pregnant woman, how can this be correct? Can someone tell me, how can this be correct? Mothers on cold floors.
The public system is in crisis, which is why the department wants to make good healthcare more accessible to the majority, said Deputy Director General in charge of the NHI, Dr. Nicholas Crisp. According to him, 80% of South Africans rely on the public healthcare system. The debate on healthcare reform started with a green paper published back in 2011. Two white papers were published in 2015 and 2017, and the bill was tabled in Parliament in 2019. Then followed a process of public hearings. The public hearings recently concluded, and many people raised concerns over the government's track record in mismanaging state funds. Besides corruption, other concerns involve structural issues in the public sector and a possible exodus of doctors and other key medical personnel if the bill is passed. Even though some parties, like the DA, have threatened to go to the Constitutional Court, the Health Department has said it will not backtrack on the implementation of the NHI. The NHI bill is currently before Parliament, but the big question still remains: how will it be funded? News 24 parliamentary journalist Jason Felix breaks it down for us.
The options tabled by the National Department of Health are, first of all, it's the surcharges on personal income tax. The second option is payroll tax, and then the last option, which was tabled about a month ago, is the reallocation of medical tax credits. That's the credit that goes, or tax credits that goes towards medical aid schemes. This basically means that all of us will pay a little bit more tax to cover the NHI. This will obviously happen in the event that medical aid services become almost redundant, and that contribution that we have paid will then go towards the NHI pool. The second option is payroll tax. Payroll tax basically means it's the tax that we get paid, that we pay to the South African Revenue Service, which is our normal income tax, our pay-as-you-earn tax. Payroll tax will be for those who do not have a medical aid, but will now be forced to pay some sort of contribution to the NHI fund to make up the fund, and obviously to get services, healthcare services, for free at any hospital or at any medical facility in the country. The last option, which is the reallocation of medical tax credits, that's really a very technical option, but could also bring out quite a number of money for the government. This is just the reallocation of funds, of medical tax credit funds, which is paid to medical aids, and the amount that has been paid in the last financial year, which is the 2019-2020 financial year, it was around about 27 billion rand that was paid. This is also an option that could be used, and that could be that was played around with to fund the NHI and to put more money in the NHI's bank, if I can call it that, to obviously fund healthcare services. I need to say that we are still quite a long way before we get to any sort of universal healthcare or any sort of NHI for that matter. Medical aid schemes, the Council for Medical Aid Schemes, various stakeholders are advocating against the NHI. It is simply too costly, number one, and number two, our public healthcare facilities are not up to standard. It's certainly not up to standard, not by a long shot.